Next up is scar care. So in this section, we are going to talk about cesarean scars as well as perineal or vaginal scars. We're going to talk about some of the goals with scar management and how to help yourself early on in this process. We'll also talk about the grades that can happen with perineals tearing. So what is the goal of scar care? The way I like to look at this is that I never feel like with my hands or when I'm instructing a client to do some scar work on themselves, I don't look at it like we're trying to break up the scar tissue. Likely that doesn't happen. Scars are super strong. But what we're looking to do is to make sure that that scar tissue can move well with the other tissues in the body. So you can see why we want an abdominal scar to be flexible. When you extend your back, we want it to not be limiting your movement. And with perineal or vaginal scars, same thing. We don't expect that we're breaking up the scar tissue, but if we need the pelvic floor muscles to move in one direction, then we don't want that scar to be limiting the movement. The other thing that can be really important to recognize early is the emotional processing that can happen when you address a scar. And so whether that's a cesarean scar or a vaginal scar, it can be really heavy emotional work. And so recognizing that if you take some of my simple tips of early scar work and you're having a lot of hard time processing, then you might also want to do some of this work in conjunction with talking with a counselor. But it can be a really nice practice that accompanies emotional work to process this whole experience. Okay, so let's talk about cesarean scar work first, and let's break it up into like 3 sections. In the first, let's say 2 to 4 weeks, you're probably still going to have some bandages on. I would say at least in the first 2 weeks. And in that stage, what I recommend is that with your bandages on and with clothing on, you just start to lightly rub your hand over that area. Commonly, scars can get overly sensitive, and just the act of clothing touching it or physical touch with your hand can be provocative. And so in those early weeks, we just want to make sure that we're doing really light touching of that area to reduce the likelihood that you're going to have that overly sensitive scar. Then, roughly at 4 to 6 weeks, we can expect that you're not going to have any bandages, but it's still not a time to be really aggressive with any kind of scar massage. And so I would probably just recommend that you do the same thing we talked about before, where you're rubbing really lightly, but now this time it might be directly on your skin. And so, potentially you still have some stitches or staples. I don't want to recommend using oil or not using oil or anything like that. You can ask your provider what's appropriate, but really light touch, not kneading, not massaging, and that's during that 4 to 6 week period where we can be skin on skin with that. And then when we start to get 6 weeks and beyond, the scars become a little bit more mature, and at that point is when we can start to move the scar a little bit. And I don't want to give any advice for this right now because everybody is going to need some individualized attention on how to best mobilize that scar. And there's going to be factors involved, like if you had any delayed wound healing, if you're having any open areas, all of that is going to need some special attention. But again, basically at 6 to 8 weeks is when it might be a good idea to seek out some help and some instruction on how to move that scar. Not that we're breaking up scar tissue, we just want that scar to move well when you move your body. And the emotional processing that can happen there, I just don't want to overlook it. So at 2 to 4 weeks, if you're not ready to touch your scar and it's going to be more provocative for you than it is going to be helpful, then that's fine. We can always work on this. Okay, I'm just giving some tips if you want to get started early, what you might be able to do. Okay, so the next thing to delve into a bit is perineal scar care. And as I said, let's talk about some of the grades of scarring or tearing that we may experience, and how that might change the scar care plan. So a grade 1 scar or grade 1 tear is from the vagina and just back towards the rectum, like a little bit, maybe a centimeter. It doesn't really extend very far. It may also go off into different directions, like towards the labia. Sometimes these scars are not repaired with stitches, and sometimes they are. So this is the type where you may have 1 or 2 stitches. And let's talk about the management once I describe all the grades. Then with a grade 2, the tear is going to extend into the perineal body. And the perineal body is where many of the muscles come together of the pelvic floor. And it's kind of right in between the vagina and the anus. It's that hard tissue there. Grade 3 can extend through that perineal body and towards the anus, but not through the anal mucosa. And the anal mucosa is basically kind of the inside lining of the anus. And a grade 4 is kind of the most complete tear that you could have, and it extends from the vagina all the way through the anal sphincter. And so you can imagine that grade 4 scar is going to require potentially a little bit more rest and kind of tenderness and space for recovery than a grade 1 tear. But what everybody can do early on is something similar to what I recommended with a cesarean scar. At somewhere between 2 and 4 weeks, with a nice clean hand, you can just start to touch from the outside. You can touch that scar. So we're not trying to move the scar side to side or anything like that. Just kind of show it on my arm here. We're just really lightly rubbing our hands over that scar. That might be nice to do in combination with looking with a mirror, just to start to kind of get used to or to get familiar with your new postpartum body. And then beyond that 6 weeks time is usually when it's okay to start doing some internal scar assessment and scar massage. And so you'll want to, when you see your provider about 6 weeks, ask if it's appropriate for you to start doing that. Most likely if they give the go-ahead for sex, then we can assume that it's going to be okay to start doing some internal scar work and a nice graded approach. So we know that a scar at 6 weeks postpartum is not as strong as a scar at 1 year postpartum. So we're going to have really gentle techniques early on that can progress into a little bit more force later. So at about 6 weeks postpartum vaginal birth, begin to insert your fingers and just kind of notice what you feel at first. If you insert and you noticed some firm tissue and there's some pain associated with it, can you give some really, really gentle pressure and do some nice deep breathing and just see if that changes your experience when you touch that area. There's a lot of ways to work on vaginal scars, but in this generalized information that I'm giving, I think just getting to know your body and your body's responses is one of the best things that you can do. But if you're having trouble with your scars or you want a more personalized approach to working on them, or to even assess if you really have any, then please seek out the help of a pelvic floor PT.